From Denver 7, this is 7 News.
Well, for some couples, getting pregnant can be very difficult, so many turn to medical science to help them have a baby.
You know, recently some of the treatments have become a bit controversial. Dr. Mark Bush, the medical director from Conception's Reproductive Associates of Colorado, is joining us this morning. Thanks for coming in so early. We appreciate it.
Thank you for having me.
We hear a lot about Octomom, maybe more than we should. Maybe it's covered a little too much. What is your industry doing now to reduce the number of multiple births?
The simple answer would be to attempt to transfer a single embryo. New genetic testing is helping us get to that goal.
And we should probably point out that the doctor in the Octomom case probably went above and beyond what you would normally do.
That was a 6 embryo transfer. We typically, our mean number or average over the last 3 years in that setting was 2 embryos.
Okay. So what is the latest of genetic testing of embryos?
We're able now to look at all 23 pairs of chromosomes in an embryo on day 3 of life and transfer that into the mother's womb on day 5 of life. This particularly benefits patients that are 35 years of age and older, recurrent pregnancy loss patients, and patients that have failed IVF. In this setting, oftentimes their inability to keep a pregnancy is because of mistakes in the number of chromosomes present in the embryo.
Essentially what I'm hearing you saying is it's becoming more efficient. You're more successful these days, and then because of that, maybe the cost is even less.
Cost is still a challenge because most insurances do not cover this technology. However, as you mentioned, it's very powerful. I mean, we take a cheek swab from the parents and get their fingerprint and use that information to resolve the accuracy of the day 3 embryo chromosome number. It also lets us know where the extra or missing chromosome came from, whether mother or father, which really can help direct future therapies.
And I think you were saying this before, that you're seeing more and more patients coming in because people are waiting longer to have kids, and that obviously can have a huge impact. So from before, I always hear from parents that sometimes it could be a long, tedious process to go through this. What about now with the latest in technology? Is it shorter? Is it easier in some ways?
Well, I think so. There are options prior to IVF that include surgery and other less invasive technologies. But for couples that do not conceive with that method, there is real hope, particularly with screening embryos, for a competent genetic embryo to be placed in the womb.
That's good news. All right, we like that. All right, Dr. Bush, thank you for coming in. We appreciate it.
Thank you for having me.
Thanks for your time. We've got more information, by the way, on our website, as always. If you'd like to read more about this, at thedenverchannel.com, just click on that big red TV button.